This morning, a young Kentucky man says his life is on hold because a heart condition left him with massive debt despite having health insurance. We're looking at his case in our continuing Bill of the Month partnership with Kaiser Health News and NPR, examining unexpected medical costs. The now 31-year-old is dealing with big bills and bankruptcy just to be able to live a normal life after years of medical care.
I just stopped going to the movies. I stopped going to basketball games.
Matthew Fentress was just 25 years old when he was diagnosed with cardiomyopathy, a condition that makes it harder for the heart to pump blood throughout the body. 3 years ago, doctors inserted a pacemaker and defibrillator in Fentress to save his life. Fentress had insurance, but when he couldn't afford his $5,000 hospital bill, he declared bankruptcy. Then this January, his cardiologist suggested Fentress undergo a cardiac ablation procedure to restore normal heart rhythm and offer him a better quality of life.
It's not really living if all I do is sit around the house and not be able to enjoy anything I used to do.
The bill for that better life? $258,000. His insurance negotiated the bill down and paid more than $26,000. But due to his high deductible plan, Fentress was on the hook for close to $8,000.
And you get so many bills that it's almost like they pile up on you.
Fentress has yet to pay any of the bill and is filing paperwork to negotiate the amount with his hospital. But until then, he says his life is on hold.
Can't get a credit card. I can't buy a house. I don't see me ever being out of debt.
United Healthcare says it's worked with Baptist Health Louisville for many years to help reduce healthcare costs. It says Matthew Fentress's procedure was covered correctly under his plan, which has a maximum out-of-pocket limit of $7,900 a year. Baptist Health Louisville says it gave Fentress an estimate of $7,888 before the procedure. It also says he has not applied for financial assistance, but is likely eligible, and they're prepared to expedite the process. We're joined now by Dr. Elisabeth Rosenthal, editor-in-chief at Kaiser Health News. Elizabeth, good morning. Thanks for being with us. Whenever I watch one of these stories, I just remember how you open those envelopes, those bills, with such trepidation because you don't know what you're going to see inside. But Matthew had insurance, so how did he get stuck with such a large bill?
Yeah, this guy is someone who did everything right. You know, you're told to buy insurance, you don't have a lot of money, so you look at the premium and buy the cheapest plan or the plan you can afford, the most you can afford. And we're primed to look at the premiums, right? And we're now kind of primed to look at deductibles as well. But what really hit Matthew was not just the deductibles, but also there's something that's kind of a nouveau charge called the co-insurance. So 20% of everything on his hospital bill, he was expected to pay too. And that's what put him over the edge.
Yeah. What is that exactly, Elizabeth?
Well, it is exactly what it sounds like. Everything you're charged for in the hospital, the patient is expected on some kind of lower level, cheaper plans to pay 20% of. And as we know, you know, the rack rate for that procedure was over $200,000. Luckily, what insurance does still do is you get the insurance negotiated rate, so it was $2,700. But still, if you look at all those different bills, it really adds up. And there is an out-of-pocket yearly maximum. In his case, it was, I think, $8,900. But the thing is, that resets January 1st. So, you know, if your procedure and your complications span 2 years, you're going to have to pay it twice. A lot of unfairness.
Yeah, and you're lucky if you don't get a heart attack just from the $250,000 initial bill. Should people avoid high deductible plans, Elizabeth? And if they can't, what should they know about that type of plan?
Well, you often can't. I mean, it's often what you can afford. So I think we have to be primed as buyers, as smart shoppers, which I hate using that term for patients, but to look not just at the premiums, but at the deductibles and at the co-insurance payments, because that's what really got this young man into trouble. And P.S., remember, he had something that is a known he actually got it from the flu, but what he had, this myocardial problem, is a problem with COVID too. It's an important complication of COVID. The heart muscle recovers, but the rhythms are often very abnormal. So he desperately needed this procedure.
All right. Dr. Elisabeth Rosenthal, thank you so much.